Pediatrician and Chief Mental and Behavioral Health Officer of Children's Wisconsin, also representing the Wisconsin chapter of the American Academy of Pediatrics. We begin today with remarks from Secretary-Designee Timberlake.
Good afternoon, everyone, and thank you for joining us today for our update on COVID-19. As we continue to live with COVID-19, we have more tools available to fight this disease. We are pleased to announce that the COVID-19 vaccine has been authorized for children 6 months and older. The Pfizer vaccine is now recommended for everyone 6 months of age and older, and the Moderna vaccine is now recommended for children 6 months through 5 years of age and for adults 18 and older. We know many parents and guardians have been waiting for their youngest children to become eligible. These approvals are an important step in further protecting Wisconsin against COVID-19, as it now makes everyone 6 months and older eligible for the COVID-19 vaccines. Getting fully vaccinated, including receiving any boosters you are eligible for, is one of the most important things we all can do to help protect our children, our families, and our communities from COVID-19 and its complications. Getting your child vaccinated and boosted against COVID-19 not only protects them, but also family, friends, and loved ones around them. It also protects them from getting really sick if they do get COVID-19, and keeps them in school, summer activities, or childcare, as well as safely participating in sports, play dates, and other group events. Safety remains a top priority in evaluating and recommending COVID-19 vaccination. If you have questions about the vaccine, please reach out to your doctor or other trusted medical professional. The United States Food and Drug Administration and Centers for Disease Control and Prevention have monitoring systems in place to ensure that any safety concerns continue to be identified and evaluated in a timely manner. And that data is closely reviewed by national experts and our own in-state medical experts before each new phase of vaccine rollout. Now is also a good time to remind parents and caregivers to ensure your child is up to date on all their vaccinations to help prevent getting other diseases. COVID-19 vaccinations can be given at the same time as other vaccines. Work with your child's doctor or care provider to find out which vaccines your child is due for. As of today, 64.5% of Wisconsinites have received at least one dose of the COVID-19 vaccine, 61.3% have completed their vaccine series, and 34.8% have received an additional or a booster dose. Additionally, Wisconsin vaccinators have administered more than 9.5 million vaccinations and over 2 million booster and additional doses of the COVID-19 vaccine. Today, we are reporting 1,330 new confirmed cases of COVID-19, bringing our 7-day average of new confirmed cases to 1,415. Our thoughts continue to go out to those of you who have lost someone to this disease. As of today, we are reporting the total number of confirmed deaths has reached 13,100. Based on the most current Centers for Disease Control and Prevention data, the COVID-19 community levels for Wisconsin include 4 counties in the high community level category, 24 counties in the medium community level category, and 44 counties in the low community level category. As a reminder, the CDC has adopted this approach to assessing community risk so that we take account not just of the numbers of new COVID-19 infections, but also of the strain that is placed on our hospitals due to periodic increases in COVID-19 cases. Residents in counties with a high COVID-19 community level are recommended to wear a well-fitting mask or respirator in public indoor settings, regardless of vaccination status. We encourage you to know the community level for where you live or where you will be traveling to, and follow recommendations to protect yourself and others from COVID-19. Information about Wisconsin counties and their current COVID-19 community level can be found on the DHS website on the COVID-19 data webpage. We will continue to ensure that COVID-19 vaccines and testing are accessible to all Wisconsinites. Please continue to follow best practices to help stop the spread of COVID-19, such as staying up to date on vaccines by getting all recommended vaccines and booster doses, getting tested for COVID-19 if you have symptoms or were exposed to someone with the disease, and staying home if you are sick or test positive for COVID-19. In addition, talk with your healthcare provider or visit a community clinic to ask about available COVID-19 treatments. Thank you. And now I will turn things over to Dr. Smriti Kari, Chief Mental and Behavioral Health Officer at Children's Wisconsin.
Thank you, Secretary-designate Timberlake. You know, as a pediatrician, I very much appreciate being able to represent all of the pediatricians in the state when I say that we're very excited and encouraged that the FDA, as well as the Center for Disease Control, has recommended the Pfizer-BioNTech and the Moderna vaccines for children less than 4 years of age. You know, this is another monumental step in the progress against this pandemic. This group of children, about 300,000 of them, are now afforded the same opportunity to get the vaccine to protect themselves from the disease. We firmly believe that in the fight against the COVID-19 pandemic, the vaccines are a very important and significant step to reduce the illness, and in particular to reduce serious illness and death from the disease. So we are strongly recommending the vaccine at Children's Wisconsin, and certainly all of the healthcare organizations that we belong to as healthcare providers are also supporting vaccination. So one of the things I did want to get into is we do often hear from people that COVID-19 didn't impact children or doesn't impact children. And to be clear, it does. You know, we've certainly seen upwards of 13 million children who've tested positive for COVID across the country. But in particular, I think we have to remember that this virus also has different variants. And you see the difference between the Delta variant and the Omicron variant. In the Omicron variant, the children were hospitalized almost at a rate of 5 times greater than they were with the previous variant. So children have had the illness, they've had hospitalizations because of the illness, and they have been pediatric deaths because of COVID-19. And I often say as a pediatrician, children are supposed to be healthy. And so any hospitalization or deaths is that can be prevented, should be prevented. So we do feel strongly about doing everything we can to keep our children healthy. In addition to the actual illness, we have had, it's definitely cases of long COVID with COVID-19 with ongoing symptoms for a period of time. Again, one of the things we worry about the most is something called a multi-system inflammatory syndrome in children. And this is caused by COVID-19 and seen after an infection. And this has made a lot of children seriously ill. So with all that in mind, I think, you know, anything that we can do to decrease the incidence of COVID-19 in children is important. But oftentimes when we think about the impact of COVID-19, we're talking about the physical impact of the disease. And, you know, I would be remiss to not acknowledge that one of the most tremendous impacts of this pandemic has been on children's emotional and mental well-being. You know, last year, in large part because of the pandemic, the American Academy of Pediatrics, the American Academy of Child and Adolescent Psychiatry, and the Children's Hospital Association actually declared a national emergency for children's mental health. At Children's Wisconsin and really across our state, we have seen a tremendous increase in children who are suffering from emotional and mental health issues. And so one of the things that I sort of see vaccination as is a tool to just decrease the impact of the pandemic in general. We had a mental health crisis before the pandemic. It's worse now, and anything that we can do to get children feeling better is, I think, very important. Statewide, we have been able to vaccinate a lot of children under the age of 17. We are doing better with numbers in the older adults, and so it is one of the areas that, as pediatricians and just healthcare workers in general, we would like our younger children to be vaccinated. In our primary care clinics and across the children's system, and in partnership with the Milwaukee Health Department, we've given upwards of 50,000 doses to children in and around southeastern Wisconsin. It's been one of the most positive things that we've been able to do in the last 2 years to really be able to protect our community. And I'm particularly proud about the teams that have been able to collaborate to make our community safer. We anticipate that with this new age group, with the children less than 5 years of age, that our Children's Wisconsin clinics, but also all healthcare systems are probably going to be much more engaged in vaccinating the children. And just something to keep in mind that, in the state of Wisconsin, we do have a statute that limits the ability for pharmacists to give vaccines to children less than 3 years of age. They require a prescription to be able to do that. And so a lot of pharmacies are working that out, but it is going to be important to call ahead and make sure that the pharmacy that you're going to does vaccinate. And it is one of the things that we anticipate that our healthcare systems will be doing more. So we're preparing for that. We do believe that most people will be able to start the vaccination either late this week or early next week. So even after the vaccines are authorized, there's a period of time that it requires for us to embed the information into our electronic health systems and train our staff to make sure that we're doing the right thing, giving the vaccines in the best safety that we can. So we do anticipate that we'll be ready to do that. Frankly, all of us have been waiting for a long time for this. I just read today that it's been 18 months since the first person was vaccinated in the country. And so it's a long awaited process here. And so we're ready to go as soon as we've got all these parts put together. And as always, while the vaccine helps, we're not over with this pandemic, and the pandemic isn't over with us, unfortunately. So it's important to think about all the things that we can do to mitigate our risk. And so, as we say to all the children, please wash your hands, but also make sure that you're wearing masks and are protecting yourself when you're in areas where there's higher incidence of the virus. And again, social distancing is always a good idea. But more than anything, I'd like to say, please remember to stay home when you're sick. I think that is one of the things we've learned in the last 2 years, is that we don't have to tough it out, and we do have an obligation to protect ourselves and everybody around us. And so please try and stay home when you're sick. And as always, reach out to your healthcare providers if you have questions and concerns. We're ready to answer them, both about the illness and about the vaccines, so that we can keep our community protected. Thank you.
Thank you, and thank you as well, Secretary-Designate Timberlake. And we now will take your questions. A reminder, to maintain audio quality, please remain muted until it's time to ask your question. If you are able to do so, you can use *6 to mute and unmute your phone. Our list is a bit shorter today, so we believe we have time for you to ask one question and one follow-up. And we start with Sean Kirkby at Wisconsin Health News. Sean.
Hi, thanks for holding this. Could you talk a little bit about how much of the vaccine is expected how many doses the state is expected to receive this week, and what's going to be the pace for these doses to arrive in the state? Thanks.
Yep, thanks, Sean. I'm happy to start, and certainly Dr. Kari can always add the local perspective from Children's Wisconsin. So we so far have ordered a total of about 48,500 doses. That's divided between the Pfizer and the Moderna products. We have been able to order both, and we have ordered both. Those vaccines are already arriving in the state, and we are distributing them in, I'm going to call it 2 different ways. So larger providers, larger health systems will be able to have vaccine direct shipped to them, although the orders do run through the state of Wisconsin. And then for some of our smaller settings, providers that maybe are ordering fewer than 100 doses, we will actually handle the distribution of the vaccine through our hubs. So that is enough to get us started. And as Dr. Kari noted, there is an additional just brief kind of ramp up period of provider training and making sure that folks have updated their kind of local procedures and protocols. So we really do encourage parents and family members that are eager to find out where they can get a COVID-19 vaccine for their young children to check vaccines.gov. That is going to continue to be the very best resource that people can use for information on availability of vaccine, and of course, for families with a regular source of care, a regular pediatrician, a regular clinic that they go to, calling that clinic is the right first step as well. But Dr. Kari, what would you add as far as what these kind of early days are looking like at Children's?
Sure. So I'll speak for our organization. I just happened to talk to the Milwaukee Health Department Medical Director, Dr. Parody, today. And I think we are expecting the Pfizer delivery either later today or tomorrow is what we're hearing. We do anticipate starting vaccination at Children's on Monday of next week. We think that's the safe time frame to be able to get everything in place. But Dr. Parody said that she anticipates that the Milwaukee Health Department clinics will probably start vaccinating a little bit sooner. So I think that is sort of generally the pattern we're going to see, because Pfizer was more commonly available for us because we're a pediatric organization. Moderna had not been approved. We are starting with Pfizer. We presume that was the quickest way to get the vaccine going while we work through receiving Moderna as well. And I think that might actually be happening in a few other places where they were more of a Pfizer shop for the first part of the vaccination schedule.
Thank you. Sean, do you have a follow-up?
Thanks. I guess looking at the vaccination data, about a quarter of kids between 5 and 11 are fully vaccinated as of now. Are you expecting that to hold true for this new group? And I mean, what do you have to say for folks who are very hesitant to get their children vaccinated?
Sure. I mean, I think that the first place to start with families that have questions about this vaccine is certainly to give a call to your child's pediatrician or other care provider to get those questions answered. We understand that these are new vaccines. In some sense, COVID itself, although some of us feel like it's not new at all at this point, really still is a new illness. We're still learning quite a lot about it. And so it's perfectly understandable that families will have questions. That said, what we're very pleased to see in the data is day after day, week after week, we are seeing more and more first doses for that younger age group that has already been eligible. And so we do expect that we will see that steady growth in vaccinations for these youngest kids as well.
And I might just add that just really pretty much as a pattern we've seen with every age group that's been eligible, there's about 1/3 of the folks who are ready to go on day one. And then there's 1/3 that really would prefer to come in, have a conversation with their healthcare provider to get the vaccine. And then the last 1/3 is a little bit slower, and we don't always get there, but we always try. And so we do anticipate following about the same pattern with this younger age group. We do see the children less than 5 5 years of age in our clinics more often with the well child visits, and that might actually expedite the ability to vaccinate because they don't have to make an extra appointment. But we'll be watching that very closely and expecting to have lots of conversations with families.
Thank you. Let's go now to Nick Bohr, WISN Milwaukee. Nick. Nick at WISN. All right, we'll try to get back to WISN, and we will go now to Alex Moe at WIS Business. Alex. A reminder, *6 will mute and unmute your phone. Alex Moe at WIS Business. Okay, how about the Kenosha News? Holly, are you on the call from the Kenosha News? Emily at WKOW in Madison. WKOW in Madison. All right, I'm not sure if we're having an issue. Let's try Casey Nelson, WTAQ in Green Bay. Casey Nelson.
Hello, can you hear me?
Yes, we can hear you. Go ahead. Thank you.
Okay, fantastic. So my question was somewhat related to the previous one. Looking at the percentage of people, around 64, 65% in general that have been vaccinated, do we expect to see those numbers reflected in children, or what are we expecting there with those percentages when it comes to children being vaccinated or parents choosing to allow their children to be vaccinated? Thanks.
Sure. What I think we really are seeing is that, again, that steady increase in vaccinations for people of all ages. Certainly it's the case that particularly in the early phases of the pandemic, we knew that older adults were at particularly high risk. And I think we all did a really great job of communicating that information to our older adults. And so that we do see really great vaccination rates for that older adult population. We do still see very strong vaccination rates, even in some of those younger age groups. And so I think that the thing we really want to underscore for parents of children, whether it's the 5-year-olds and up, or now the 5-year-olds and younger, as Dr. Kari noted, COVID is not risk-free for children. I know that we're at a point in the pandemic where we all know someone who's had COVID and maybe they experienced it as a cold, or maybe they were asymptomatic entirely. Just a couple of numbers I would add to the data that Dr. Kari shared. We have had more than 2,800 people under the age of 20, so 19 and younger, hospitalized in the state of Wisconsin with COVID-19 since the beginning of the pandemic. That is really a substantial number of hospitalizations. In addition, we have had a total of 15 people under the age of 20 in Wisconsin who have died due to COVID-19. And just as a point of comparison, over the last 2 flu seasons, we have only had 3 deaths due to flu reported in that same age group. So while most children will do just fine if they do contract COVID-19, it remains the case that vaccines are the very best way that any of us as parents can provide that protection for our kids against serious illness, hospitalization, or an even worse outcome. And we know that kids live in families and they're interacting with lots of people, hopefully interacting with older adults and older relatives in their lives. And we really do want to continue to keep all the members of our families and all of the members of our communities safe. And so for all of those reasons, we really do strongly recommend that kids get vaccinated against COVID-19.
Thank you. And Casey, do you have a follow-up? All right, that sounds like a no. So let's head to Jenny Peak at Wisconsin Public Radio. Jenny at Wisconsin Public Radio.
Hi, what advice do you have for parents and guardians trying to book appointments ASAP for their children?
Yep, so I would recommend strongly, first of all, checking with your child's regular source of care. So pediatrician, regular family clinic, wherever your child goes for their regular well child care is the absolute first place to start. In addition, checking vaccines.gov will be important. We understand that some of the functionality in vaccines.gov is in the process of being updated as we speak, so that families will be able to really filter by the age of their child, potentially by the particular vaccine that they're interested in. And then a third option for people who just are not comfortable navigating vaccines.gov or don't have a usual source of care would be to call the 211 service in Wisconsin. They have been great partners with us. They will have good information as well, to Dr. Kari's point earlier, about some of those public health clinics that may be available for folks who don't have a usual source of healthcare. So vaccines.gov, your usual care provider, or call 211. All of those are going to be good ways to get started.
Thank you. And Jenny, do you have a follow-up?
Yeah, and then just real quick, do you happen to have a breakdown of what areas across the state can vaccinate children under 3? You mentioned the statute that makes it so that not everyone across the state can vaccinate those 3 and under. And so I was just curious, any other information you can add regarding that would be great.
Dr. Kari, do you want to build on that, or do you want me to take that one?
Sure, happy to. So to be clear, I was actually talking about pharmacists and not healthcare systems. So healthcare systems, if you are, if you vaccinate, you should be able to vaccinate all age groups. So just for the pharmacists, there is a requirement that they need a prescription from a healthcare provider to vaccinate any child less than 3 years of age. And for 3 to 5 years of age, if the pharmacist participates in the Federal PrEP Act, Public Readiness and Emergency Preparedness Act, then they can vaccinate without the prescription. But if they don't, then they do require prescriptions from providers. And any child 6 years and older can be vaccinated in a pharmacy without the need for a prescription from a provider. So what I was really calling attention to is that in the older age groups, the retail pharmacies really carried the weight of creating lots of appointments. And in this age group, it might be a little bit different, where you do actually have to make sure that the pharmacies are providing vaccines to the younger children. And so that was really the nuance I was getting to. I think any other healthcare system that vaccinates children should be ready to go if they are ordering the vaccine and giving the vaccine.
Wonderful, thank you. Let's try Benita Matthew, Green Bay Press Gazette. Benita.
Hi. Hello, can you hear me?
Yes, go ahead, please.
Great, thank you. So I was just wondering about the process of ordering doses. You said that you ordered about 48,000, so I was wondering how you would determine how many doses you would need.
Yeah, great question. So it's kind of a combination of supply and demand, if you can think of it that way. So similar to the other rollouts of other rounds of COVID-19 vaccine, the federal government has purchased the supply that is being made available through state health departments and out to the kinds of healthcare providers and community partners that we've been talking about. So Wisconsin so far has an allocation from the federal government of a total of just under 126,000 doses, again, divided between Pfizer and Moderna. We don't need to take delivery of all of those doses in the state just yet. We may as well kind of get started and get this rollout going. And so based on an initial survey that our vaccine task force made of providers around the state and vaccinators around the state, it was using that data that we were able to assess the approximate number of doses that we thought we would be able to administer in the early weeks here. And so beginning with that, as I said before, kind of 48,000 and change initial order, we will absolutely be able to get all of that vaccine out, and then we'll be able to continue to order vaccine as our providers need us to do that.
I might just add that it's been a wonderful partnership with the Department of Health over this last couple of years, just really good surveying of all the healthcare providers, exactly what we can store, what we anticipate giving. So we are usually looking at our patient base to see how many doses we anticipate giving, and we're able to send that information to the department, and then they distribute appropriately. So it's been a fairly smooth and seamless for the last 2 years.
Thank you. I will give that feedback to the team.
Wonderful. And Benita, do you have a follow-up? Okay, hearing none, let's go to Eric Dunn at the Wisconsin Examiner. Eric.
Hi, thank you for taking this question. I want to talk about the segment of the population that is disconnected from the healthcare system, does not have a regular healthcare provider, may not even have access to or avail themselves of the sources of information that all of us on this call might represent. How many folks in the state are we talking about who are kind of in that kind of limbo, information-wise and network-wise and so on, and what's being done and what can you do to make sure that they get the information and the access to the vaccine and even to things like testing, and even the information that maybe if they're in a high-level county that they need to be wearing masks all the time?
Yep, great question. So certainly the partnership that we have with those of you in the media is a key strategy, because we know that whether it's people who don't have immediate access or ready access to the internet, or people who may not know to call 211, the reality of it is that we think it's most people in the state that will either be able to access the internet, will be able to make a call to 211, will follow the kind of coverage that you all are going to put out today to provide information about this important new approval of these vaccines and how families can find out more. That said, though, in terms of points of access, you're certainly right that not every family has a regular source of care. Not every child gets regular well child visits, although thankfully most do. In order to kind of provide a backstop or a safety net, if you will, for families in that situation, we have continued our strong partnership with AMI, which has been the private healthcare provider that has stood up a number of vaccine clinics over the past couple of years now. We are maintaining 4 static site AMI clinics, and those are in Rock County, Racine County, Marathon County, and Douglas County. In addition, we have worked with AMI to have some smaller sites and some more flexible sites in a number of additional counties, and we have AMI resources that are available to be used as essentially mobile vaccine clinics or kind of pop-up clinics. And we are able to decide where to stand up those clinics in partnership with our local and tribal public health departments, who really know their communities best and are able to let us know whether they have the resources that they need to go ahead and stand up a vaccine clinic. For example, Dr. Kari mentioned checking in with the City of Milwaukee Health Department on their plans, but we have regular calls several times a week, actually, with all local and tribal health departments who are very quick to let us know when they have a need for some additional support around vaccination. You also mentioned testing, And one of the real successful programs that we are very proud to have offered throughout the course of the pandemic is our community testing support program, where we have signed up a wide variety of both healthcare providers, but also pharmacies, community clinics, other kinds of settings to be places where people can get COVID-19 tests. And similar to checkvaccines.gov or call 211, there is a great resource on the DHS website for where those community testing sites may be available. And in addition, calling 211 for folks without easy access to the internet is another really great resource for people. So we understand that people need access to vaccines and COVID testing in all 72 counties of the state. And we continue to work hard to make sure that that access is equitable as much as it can be all across the state.
Thank you. And Eric, a follow-up.
Oh, if I could just add one more point. A lot of the public health departments really try to have vaccine sites in schools, which tend to be in a place where most people can get information if they have young children. And so that was also one of the things that I think the Milwaukee Health Department did well. That's the one that I'm most familiar with, but I know the health departments across the state really worked with their local schools to be able to get that information out.
And I guess for a follow-up, I would be curious to know if there's any kind of a ballpark number as to what size of this more disconnected population might be. Are we talking, 1% of the state population, 10%, or something else? If we even have an idea of what, how many people are potentially in that less connected segment of our society.
Sure. What I would suggest, Eric, is let us give you a couple of different ways of looking at that. So let us take that back for some follow-up, because again, I think we could give you one answer that would look at, for example, children who may be uninsured in our state, which is actually a fairly low percentage. But even families and kids who are uninsured have access to COVID testing and COVID vaccines through these other community resources that we're describing. We could talk about families who don't have broadband internet, but that doesn't mean that they have no access to the internet, right? So I think that it's a good question. I think that there are a number of different ways to look at it, and we'd be happy to follow up.
Thank you. Then let's give the next question to NBC 26, Tyler at NBC 26.
Yes, thanks for taking my call. I'm wondering, how should parents talk to their young kids about getting vaccinated?
That's a great one for Dr. Kari.
So in general, most of our parents actually, as they come into our clinics with other vaccines that they're getting, are almost always telling kids that this is going to be something that gives them the ability to be able to fight disease. And so I've always liked that. I have used it gives you superpowers to fight disease is one of the things that, especially for the younger kids, really works. I do have to remind them that that doesn't mean that they can fly, so they still have to be safe. But that's one of the ways that we go about it. I think with COVID-19 in particular, though, that one of the other things that we find parents sharing with their children is also about keeping people safe around them. So, especially about keeping, elderly caregivers, grandparents, uncles, aunts, things like that. So children are just naturally altruistic and really resonate to that about being brave for the vaccine so that they can keep grandma safe. And so that's one of the other things that we tend to talk about. And that seems to have a lot of effect as well. And then also keeping them in school and in activities that they like. So the ability for the vaccine to prevent illness so that they can do the things that they really truly enjoy. That tends to be one of the other things that really works when parents are talking to children.
And the only other thing I would add to that is we have a resources page on the Department of Health Services website for parents and guardians. I know many health systems would have similar kinds of resources. And then the national chapter of the American Academy of Pediatrics runs a wonderful site for families called healthychildren.org, which also has really nice kind of question answer resources as well. So lots of places to look for that kind of advice.
Great. And Tyler, a follow-up.
Yes, I do. I'm actually kind of wondering, I mean, if any of you know the answer to this question, when possibly the doses for the young kiddos will be distributed to healthcare systems in Northeast Wisconsin. Thank you.
Yep, happy to look into that and follow up. We know that the doses are in the state, if not today, coming soon, as Dr. Kari noted. I have no reason to believe that there'd be geographic differences in that distribution, but let us just double check that with the vaccine team, and we'll be happy to follow up.
Wonderful. We will do that, and we will go now to Megan Marshall at Spectrum News 1. Megan. Megan at Spectrum News 1, *6 will mute and unmute your phone. All right, we do have a few minutes left, so we will try to get to some of the reporters who were not on the call when called on. WISN Milwaukee, WISN. WIS Business, Alex Moe at WIS Business. The Kenosha News, Holly at the Kenosha News. Emily at WKOW in Madison, WKOW. All right, well, with that, we will wrap up today's briefing. Thank you to Secretary-Designee Timberlake, Dr. Ryan Westergaard, Dr. Kari, and thanks to all of you for participating. Please continue to monitor the DHS COVID-19 web pages for data and for guidance. Be safe and have a great afternoon.